I spent a brief time working as a criminal defense attorney. And a brief time for the following reason, and those of you who have heard this story before, please keep it to yourself. I was asked to represent a very nice woman who was accused of murdering her ex-husband. I'm sure some of you can sympathize. And the evidence was very bad, which is why they gave it to the new guy. Pretty much all the evidence was against us. The only thing I had going for us was the fact that they never found the body. Kind of a big piece, right? Never found the body. So after everything was said and done, closing arguments, I said to the jury, I said, ladies and gentlemen of the jury, I know it looks bad, but the fact of the matter is, my client did not kill her ex-husband. In fact, her ex-husband is still alive. And he's going to walk through those doors in the next 5 minutes. Everybody on the jury turned and looked. 5 minutes come, 5 minutes go, doesn't show up, they look back to me. I say, okay, I lied. But the fact of the matter is, you all looked, which means you doubt he's dead, which means there's reasonable doubt that my client murdered her ex-husband. Thus, you cannot convict her. Right? That's good stuff, right? That's good. Thank you. Thank you. They go in, they deliberate. 5 minutes later, they come back, guilty. Guilty! Are you serious? I said, guilty, but you all looked. And they said, yes, we did, but your client didn't. So, all right. Yeah, it's going to be one of those afternoons, guys, all right? I'm going to try and make this fun. It's all downhill from here, because it's just the name. When you see the name, I want you to think happy thoughts. So these are the topics we're going to cover. We got self-funding, the facts, cost containment, healthcare reform. Very general stuff. You'll find we'll talk about some of the specifics under those categories. So self-funding, the facts. All right, what do we know? You've already heard earlier in the day about the savings you're enjoying with Cypress in particular, which is outstanding, I mean, exceptional. But in general, self-funded plans not only have been saving money when compared to fully insured options, but self-funding itself is growing as an industry. You may not realize this, but healthcare reform actually required the HHS and DOL to go and perform a report, a study on self-funding. The goal, we thought, was to prove that self-funding is not financially viable, that if employers self-fund, they're going to end up leaving all their employees high and dry, and that healthcare reform needs to be crafted in such a way to eliminate self-funding. And what these government agencies ended up coming back reporting is that not only is self-funding viable, it's actually better in a lot of ways than full insurance, which, you know, that's stuck in some people's craw. And these are also some of the statistics that they found, that there's been a growth, it continues to grow. Self-funding is not restricted to large employers. You've heard it all before because you're either self-funded or considering self-funding, I assume. Otherwise, you just wandered in here because you got lost when you were looking for the dollar slots. So, in addition to that, one of the biggest issues that they were dealing with when it comes to self-funding is right here. A lot of employees and people who represent employees, the advocates, the people who are discussing whether self-funding is a good idea, one of the big concerns is I don't want my employer, whether they know it's me or just a claim number, making my claims decisions. I don't want them approving or denying my claims because if they're funding the claim, they have a conflict of interest. It's their money, and they also control whether the claims get paid or not. So aren't they financially incentivized to deny my claims? And so that was sort of an attitude that was going around. Now, the first issue I have with that attitude is, if I'm a fully funded insurance carrier, I take your premium money. Now it's my money that I pay claims with, and I'm the one who makes the claims processing decisions. So there's really no difference there. So I don't understand where that mentality comes from in the first place. I guess because it's a faceless organization, they're objective, whereas if it's your employer, you know they're out to get you. In addition to that, not only are you on equal ground when it comes to the conflict of interest, but the report went on to say most employers, when it comes to day-to-day claims, even though they have the authority to make the final decision, more often than not rely on the judgment of a third-party administrator. TPA like Cypress, who is far more objective and has far less conflict of interest than a fully funded carrier because the TPA doesn't pay the claims with their own money. They have that degree of separation. Okay, that's one. Two, employers actually have more incentive to pay claims and be more generous than an insurance carrier because they enjoy a direct benefit from a happy, healthy workforce. People aren't having their claims paid. They're unhappy. They're unhealthy. They're not productive. I don't know about you, but most employers don't hire people in order for them to have sick days, right? You hire them because you want them to come to work. They come to work if they're healthy. They're healthy because you're paying their claims. It's a happy circle. So again, proving that the conflict with self-funding, not actually accurate. All right. Other forms of cost containment issues, topics, things that you've probably heard, keywords. Again, I don't have very good eyes anymore. They've gotten bad since law school. So I tend to try and keep it, big font on the screen. Subrogation reimbursement. Real quick about subrogation reimbursement. As an industry, we use the term subrogation. That's it. We call it subrogation. You've probably heard it before. Subrogation is actually very, very, very rare. Very rare. What subrogation is if you have a plan participant, they're injured by a third party, your plan pays the claims, and that plan participant chooses not to pursue a claim against the responsible third party. Maybe it's that hot girl from down the street and he doesn't want to file a claim against her because he's hoping they'll go out sometime. But whatever it is, or it's my mom, I would never file a claim against my mom. Or, oh, I don't own the property, I fell down the stairs, but I don't want to file a claim because then the landlord's going to be pissed at me and turn off my hot water. Something like that. They don't want to file the claim. Your benefit plan can step into their shoes and file a claim against the responsible third party in the participant's name. Do you know why that's so rare? Because this is America, and in America we sue people. And very, very rare to see a plan participant come out and say, gosh, golly, gee whiz, I have a moral obligation not to file a claim. Trust me, if there's an opportunity out there, they're going to file the claim. When you have a plan participant who files the claim against the third party, recovers money, and you go to them and ask them to reimburse the plan, that's called recovery or reimbursement. Technically, legally speaking. Do I have anybody here from California? You're all by yourself. Can you believe it? Unbelievable. In California, under state law, which doesn't necessarily apply if you're a private self-funded plan, but interesting. In California, under state law, seeking reimbursement from the plan participant is legal. Subrogating, stepping in, taking someone else's legal right away from them, illegal. Interesting, right? So if they choose not to file the claim, you can't do it in their name, and the third party gets away with it. Nasty stuff. Anyway, subrogation reimbursement, very, very good, very, very important. I know it was listed on one of Jim's slides as one of the ways to reduce the trend if you're a self-funded plan. Overpayments. Nobody wants to talk about overpayments. I'm telling you, as clients of Cypress, and they're probably going to pull me off stage, overpayments happen. The problem is, nobody wants to think about overpayments because they seem to indicate that somebody made a mistake. You were supposed to pay $5,000, you added an extra zero to the check. What a stupid mistake, right? Overpayment. The fact is, though, a lot of overpayments occur because of fraud, because of misrepresentation, because of a coordination of benefits issue, and you only discover that the overpayment occurred after the fact. And there was no way to realize that there was an overpayment until that point in time. So the plan's ability to go to the provider, to go to the participant, to explain that there was an overpayment and get that money back is also a very key, important thing for a self-funded plan trying to contain costs. Medical tourism. I'm not going to go too far into medical tourism. You do want to make sure with medical tourism, and I'm always going to refer back to plan documents because I have a special place in my heart for plan documents. I know, it's terrible, right? I'll tell you a quick story. One of my first business trips with Adam and Mike, the other owner, we went to visit a TPA in Wichita Falls, Texas, not Kansas. And they told them that, listen, if you bring us on board, we'll do a free review of your plan documents. And they said not only would we do a free review, but Ron's going to work on it all weekend, and you'll get your review on Monday. And it's like a Thursday, right? And God bless them. They look at me, they say, all weekend, what do your friends think of that? And I say, plan documents are my friends. So I was still kissing butt at the time, right? I don't do that anymore. So medical tourism, you want to make sure that in your plan document, if you bring on board a medical tourism plan, okay? I got somebody flying out to Qatar, right, to get their appendix removed. They're staying at a resort. It's a sweet deal for everybody. We're all saving money. They're having a good time, right? Just make sure they don't bring back any produce. The problem is, in the plan document, there's an exclusion for claims for treatments occurring outside the United States. Not every medical tourism company out there thinks to look for that in the first place. And then when your stop-loss carrier, not looking to start a fight with anybody, your stop-loss carrier, they look at the plan document, they look at the claim, and they say, according to the plan, these should have never been paid. Now, hopefully it didn't hit spec. That's why you sent them to Qatar in the first place, right? It's amazing what you can get for a couple shekels over there. But the point is, you got to make sure that the plan matches your program. All right? Allowable charges. Very few plan documents clearly and explicitly set a ceiling on the max allowable. And we're going to talk about how this applies a little bit later when we talk about networks and usual customary and how charges are skyrocketing out of control and how do you contain it without being sued. All right? Allowable charges, keep that in mind. Payment caps, same idea. Audit rights, same idea. Being able to look at the claims. I'm going to tell you about a very interesting case out of California about audit rights and fraud. And then last but not least, wellness. I know Tom talked a little bit about it. Return on investment, access to data. I think that's the key right there, is the access to data. And our friends from Partners, they were talking about this when they were talking about wellness and diabetes programs. The fact of the matter is, if you're a fully insured plan, you don't have access to claims data. So it's very hard to tailor a wellness program to your particular group's needs. But if you're self-funded, and granted there are certain restrictions on what you have access to, I mean, I don't know how many acronyms there are, right? GINA, HIPAA, ADA, PPACA. And by the way, anyone who calls PPACA, the healthcare reform, PPACA, you might have heard that one. You know this. I can't stand that because it sounds like alpaca, and alpacas are really cute, and PPACA is anything but, so I call it PPACA. So anyway, lots of laws that control your ability to review the data. I'm right? Although, do they spit or are those just llamas? Because I suppose that's a commonality right there, right? So looking at cost containment and the crazy rising prices of healthcare, there was a story, it was ABC News. Basically, you had this little girl, she's on vacation, they're out of network. They go to the hospital, she's got tummy issues, it's appendicitis. So they cut her open, take it out, bing, bang, boom, no problem, no complications whatsoever. Family gets the bill, it's like $35,000. They submit it to their plan pays a certain amount, they're being balance billed like an entire $1,000. It's amazing, by the way, how you hear about a family who's being balance billed like $100 here, $1,000 there, and it's in the news, but the ones that are being balance billed like $100,000 you never hear about. I don't know why these newspapers don't pick up on the really juicy ones, but anyway. So this family now, they're left with a $1,000 difference, and they're, you know, why doesn't our plan cover the rising costs? Well, this caused the Robert Wood Johnson Foundation to do a study on appendicitis and appendectomy claims around the country. They restricted it to 0 complications to avoid all that kind of stuff. And what they discovered was that, oh boy, dude, I'm going to pick on you all day, man. West Coast is the best coast, right? I should be flashing gang signs. The smallest bill was $1,529. The biggest, $182,955. Just to tell you, if you keep the appendix in you, you could go and buy a Bentley or a Maserati. Just drive a couple hours north or east and just get the surgery in another state, you know? That's all I'm saying. It's like gold. Anyway, so obviously, you know, we know about this. We know about this. But this kind of a study makes a big stir publicly. All right? This is the kind of thing that gets into the news. And hopefully you're going to see a little bit more. We talk about transparency. And it's a little slow coming, but this is the type of thing you're starting to hear about. And we're going to talk about my home state. Technically, it's a Commonwealth of Massachusetts in a little bit as well. This is actually about the implants. I think we've got, this is fantastic, by the way. We got the organ transplant, 9:45 a.m. So, you know, make sure you eat light because transplants are early in the morning. Transplant costs, obviously a huge expense. Dialysis, this is incredible. They recently came out with the financial statements for DaVita and Fresenius. And their profits this year are outrageous. Outrageous. And I guess that's what happens when you're literally buying up every dialysis clinic. There's a constant customer base. They're dependent on you, right? You're the only in-network game in town. So, of course, you know, I'm in the wrong business, right? So the dialysis, not only is the selection of providers shrinking, but the cost is going up. Utilization is very difficult to shrink. I mean, we talk about type 2 diabetes and asthma and allergies and all these things that we could conduct some sort of preventative care. But when it comes to end-stage renal disease and other conditions that require dialysis, it's much more difficult to address ahead of time. And as a result, you're seeing just a steady increase in costs, and not really steady so much as the growth. And what's really interesting here is when you look at the payers, it's difficult to see, I apologize, but when you look over the years, the cost has stayed relatively level. Do you know who that bottom line is? Medicare? You're right, Medicare. You know who that is? Yeah, I'm going to ruin your appetite. That's you. So a lot of people, they say, well, you know, I hear that there's all these issues. I hear that there's all these problems, but I don't have to worry because I'm a private self-funded ERISA plan. And people throw that word ERISA around like it's a magic word, your get out of jail free card, right? People seem to think there's a superhero named ERISA man, right? Anytime someone says, oh, there's this law, oh, there's this bill, oh, there's this contract, you could fly in and just go, bam, ERISA man, right? I don't have to obey the law. You know, it's like, I tried. I came through TSA. And they're like, ID. And I'm like, I don't need an ID. I'm ERISA man. And, you know, you end up in your boxer shorts in a tent. So the point is, ERISA, basically, all ERISA allows you to do as a private self-funded plan is enforce the terms of your plan document as written across state lines, which is really nice. Because a lot of the most heinous, most difficult insurance regulations to keep up with are state-based, like California. If you're a private self-funded ERISA plan, you could avoid most of those. But that doesn't mean there aren't federal regulations that apply. Everything under healthcare reform, not specifically designated for state insurance only, applies to you because it's a federal law. All right? There are also other times that you're going to have to address a state rule or regulation, and we're going to talk about it, how it implies, how it affects you when they regulate stop loss a little bit later. But the point is, just because you're in an ERISA plan doesn't mean you can ignore the law. That's one. And two, if you don't have strong plan language, if you don't address the issue in writing preemptively, there's a chance that the court or whoever it is that's reviewing the plan and reviewing the facts, they're going to rule against you. So looking again at subrogation and reimbursement, which is something that my company's been doing, that's really where we cut our teeth. We were originally a subrogation and claims reimbursement firm. And I'll tell you really quick how we ended up just pretty much doing everything. We did subrogation, and subrogation rights, reimbursement rights, are based on your plan language. Some circuits more than others. The Ninth Circuit is very difficult. It's where California is located. And what happened was we work on a contingency fee when it comes to claims recovery. I recover some money for you. I keep a portion for myself. I send you the rest. We're all happy. The problem is I had all these clients come on board. I start handling cases, working really hard, never see my family. Next thing you know, the attorney says, okay, you've convinced me. I'll send you a check for reimburse you for your lien. All right, way to go, victory. He says, just show me where in the plan it says you've got this right. I look at the plan document, and it's not there. So we started writing plan language for our clients when they come on board. They like the subro language so much, they said, hey, can you do the exclusions? Hey, can you do the definitions? Hey, pretty soon we're doing the whole plan document. And then people say, well, now that you wrote the plan document, can you help us apply it to the particular facts? Hey, how does this relate to healthcare reform? Things like, and that's where then the consulting business comes in. But it all started with subrogation reimbursement and plan language. So the moral of the story is, if you don't have strong plan language, I can't do anything with it. And if I can't do anything with it, I can't afford the cat litter. So the bottom line is, I need you to improve your plan document so we can both be happy. Happy wife, happy life. Plan documents, another big one. This is a great one. I don't know, who here has ever heard the term never event? A never event, all right? Yeah, a never event is an event that should never happen. I wish everything were that easy, right? A lot of people tend to confuse never events with medical malpractice. Let me explain the difference between a never event and medical malpractice, all right? Keep this, you bring it with you to dinner, you tell your friends and family, okay? Malpractice is a never event worth a lot of money, okay? That's it. Because you got to prove malpractice with an attorney and expert witnesses, and that stuff doesn't come cheap. So I give you an example, all right? You go in, they treat you, and in the process, you get electrocuted, which causes numbness in your lower body for the rest of your life. Permanent damages. Obvious negligence, extreme damages. All right? Malpractice. You go under the knife, they leave a sponge in you, they close you up. Before you're even out of the anesthesia, they realize that they, when they do the count, that they closed you up with a sponge in you. They pop you back open, they take the sponge out, and then they close you again. Not malpractice. It was negligent. It was stupid. They're going to charge your plan for the second procedure, by the way, just letting you know. But as far as I'm concerned, as the patient, what? I'm under the knife for an extra 15, 20 minutes? Oh, boo-hoo. There's not a lot of damages there. That's not malpractice. My attorney, he's going to say, no, there's nothing I could do with this. That's a never event. And the difference from your perspective, as a benefit plan, when it comes to malpractice versus a never event, with malpractice, that's a subrogation reimbursement situation. You paid the claims, your participant, they file a claim against the provider, they recover some money in their lawsuit, they pay you back. Great. A never event, they're not filing a claim. Furthermore, it doesn't even make sense for you to subrogate. Remember I mentioned if the person doesn't file a claim, you can do it in their name? That's subrogation. Well, there's a reason they didn't file a claim. It's not worth the money. Well, it's not worth the money for them. It's probably not worth the money for you. So you're not going to hire an attorney either unless you can find one that works for free. And I don't know any attorneys that work for free. And expert witnesses and all that, so forget it. You're not going to file the malpractice claim. So you want to avoid the claim in the first place. How do you avoid never events? Well, Adam, and some of these are Adam's slides, it's sort of a last-minute, hybrid. He's got a buddy, actually, who works up in Salem, with the witches and everything, at a garage. He owns an auto mechanic garage. And we like to joke about him and all his buddies. They get together, and they all agree. So this is how much we're going to charge for this. This is how much we're going to charge for that. Guys, that's usual and customary. If you open your plan document, and it defines usual and customary as what everybody in the area charges, well, if everybody's ripping you off, then it's usual and customary to rip you off, right? But just because it's usual and just because it's customary doesn't mean it's reasonable. And that's one of my big hang-ups when I look at a plan document and I see usual, customary, reasonable clumped together as a single term. Because usual, customary should refer to the price. Reasonable should refer to the procedure. So going back to my example, where they left the sponge, right? They pop me back open, take the sponge out, close it up. They charge my plan not only for the initial surgery, but for the second procedure as well, to remove the sponge. And let's say it's another $5,000, $10,000, $15,000 total, not enough to file a malpractice claim, but something you'd rather avoid paying, right? Right, you could probably come up with something better to use your money on, like, I don't know, blackjack downstairs. At least then there's a chance of winning. So you get this claim for the sponge, and the $5,000, $10,000, $15,000 they're charging you, it's half of what every other hospital would charge to remove a sponge from a person's body. Wow! You know, is that usual? It's better than usual. Is it customary? It's better than customary. But is it reasonable? Hell no. And that's the difference. And you need to clarify in your plan usual, customary, price, reasonable procedure. And that'll hopefully help avoid never events. And one of the reasons you really don't want to just use never event, the term never event by name, is because there's no real industry accepted definition of what a never event is. And you know that if you put something in your plan document, it not only applies to your plan, it applies to your stop loss as well. And you may pay a claim that you don't think is a never event. Your stop loss gets it. They think it is a never event, and so they don't reimburse you. And now there's a dispute over what never event means. Whereas with reasonable, especially if you define it as something that's within the discretionary authority of the plan administrator to decide, you're not basing it on some undefined term like never event, which is like bell bottoms, it'll go out eventually. I mean, there was one point, I think, who was it? It was like HCC or something. They put out a memo that they were going to exclude in all their stop loss policies never events, and then they withdrew that, you know, a year later because there was such dispute over, you know, what's a never event. So, other gaps. Now that we're talking about stop loss and plans. First, let's look at a gap in your plan document itself. I don't know if you realize this, but the DOL came out with rules and regulations as far as exclusions apply. One exclusion you probably frequently see in your plan document is an exclusion for illegal acts. If somebody's injured during the commission of an illegal act, it's excluded. All right? I'm sure some of you have seen that. I'm sure others of you have had your claims excluded because of it. I don't know. Maybe not. The night is young. The night is young. So what the DOL said is in that exclusion, there's an exception to the exclusion. And that exception is unless it occurs as a result of domestic abuse or domestic violence. Okay? I don't know what scenario they're thinking, but now if you read the exclusion, it says, you know, claims are excluded if they're the result of an illegal act unless it was caused by domestic abuse. Okay? Or arises from domestic abuse, whatever. An act of domestic violence. We had a claim. And this is, I think, one of the benefits of working with us. It's sort of one of those things, you know, the scared straight thing where the kids are misbehaving and they bring in these like old, you know, gangbangers come in the wheelchair. They're paralyzed from gun wounds and they've been in prison for 20, 30 years. And they're like, you don't have to go there. You don't have to be where I've been. You don't have to do what I did. You got to straighten up. You're going to be like me. One of those things. I've got clients who are so messed up and have had such bad lives that I could take their sad stories and help prevent you from dealing with it. And this is one of them. Learn from their, listen, come on. I don't want them to have suffered in vain. They weren't my client at the time. I want to clarify. So we've got this situation where plan participant comes home, drunk, beats his wife, breaks his hand in the process, goes to the hospital to treat the broken hand. Broken hand claim arrives on the plan's doorstep. The plan wants to exclude the claims as coming from, arising from an illegal act. You with me so far? It makes sense? You know where this is going? Yeah. He gets an attorney who says, this arose as a result of domestic abuse. Therefore, you have to pay the claim. Can you? Yeah, right, exactly. Can you? Yeah, it's real. Man, attorneys are like scum, right? Seriously. So now we take the language and we change it to say unless it's the result of being the victim of domestic abuse. But it's semantics. It's these little things you got to watch out for. Fortunately, as a self-funded plan, you have the ability to address that. Again, sticking with the illegal acts exclusion, I had a situation where the plan had an exclusion that says, we will not pay the claims if they are the result of a felony. A felony, felonious behavior. I'm sure some attorney that doesn't know anything about self-funding or ERISA or any of that, you know, it's somebody's cousin, he put it in there because felonious, it sounds Latin and it's really, you know, impressive. And the person who's getting it is like, whoa, 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 well worth the money, right? So your exclusion says felonious behavior. Just so you know, you have to try to commit a felony. They don't just happen, okay? It's a year in prison. I think last I saw it was a $100,000 fine or both. It's a big deal, a felony. Their stop-loss policy had an exclusion for claims arising from an illegal act. There are a whole classification of illegal acts that are not felonies called misdemeanors. And one of the bad ones, DUI, DWI. So you know where this one's going. They've got a plan participant, drinking, driving, hits a divider, serious injuries, hits spec. They're paying the claims because driving under the influence is not a felony, and they only exclude felonies. They send it to stop-loss. Stop-loss denies because it is an illegal act. That's what I call a hard gap in coverage, where there's an actual difference in the language, and you need somebody to just compare the two and make sure it's not there. And if it is there, figure out a way to close the gap. Easy to understand, right? Good. Soft gap. This is what happens when you have a stop-loss policy that basically says, we don't have our own exclusions, we don't have our own terms, we're totally user-friendly, and we mirror the plan document. Whatever the plan says, that's what controls us. However, we have a right to interpret the terms of the plan as they apply to claims for stop-loss reimbursement. So, sticking with the illegal act. Let's say I've got somebody who is, I don't know, jaywalking, right? They're not using the crosswalk, they're jaywalking. Bam, they get hit by, a moped, right? It's a really big moped because now the claims are going to hit spec, all right? I didn't think that went through. It had, like Ben-Hur, it had the spikes coming out the wheels and everything. It takes them right out. So anyway, claims hit spec. The plan, because they don't want to set precedent that jaywalking is an illegal act for exclusion purposes, they pay the claims. But then stop-loss, reading the exact same exclusion, they say that jaywalking is an illegal act, and therefore they're not going to pay. So here, we're not talking about a difference of language. We're talking about two different interpretations of the same language. Right? This is highly relevant when we talk about usual and customary. Because a benefit plan may think that the PPO rate, so whatever the provider charges minus the network discount, is usual and customary in their opinion. But their stop-loss thinks, if you're paying 200% or more of what CMS Medicare pays, that's excessive, and therefore not usual customary. Again, I'm just pulling these out of the air, but they're based on true experience. Whether you're talking about a hard gap or a soft gap, the best way to deal with these things is to sit down with your carrier ahead of time and address it. Because if you wait until the claims come in, nobody's happy. Nobody comes out of that one happy. So, speaking of PPOs, we're going to talk a little bit about networks. A report recently came out that shows that while the rate of growth in a classic PPO plan's costs has actually decreased, so the percent growth has decreased, the actual amount has not gone down pretty much ever. It's at an all-time high, and I'm sure next year, if you dare to invite me back and actually invite me, instead of having the good fortune of something happening to someone else, then I'm sure next year it'll be at an all-time high, even if the rate of growth is only 1% instead of 7%. So let's talk about PPOs. Originally, the concept of the PPO was based on competition. All right? Competition. It's the capitalist way, right? I've got 5 facilities in town. I go to all 5. I tell them I've got 500 employees on my plan. I'm going to direct all 500 employees to go to one of you. Whoever offers me the best discount off of fair market value, you're my guy. You're my in-network facility. And if one of my employees goes to the others, they're going to get whatever you charge in a check, and they're going to have to make up the difference. And the provider, they're saying, wow, great, increased revenue, more steerage. It's what's called steerage, more customers coming through the door. Of course, I'll offer you a discount off the same price that we all charge the fair market value. The problem is, over time, the networks grew until it got to the point where you weren't looking to see whether your provider was in-network. You were looking to see if your provider was out-of-network. It's a subtle difference, but the point is, and you all know it, the booklet has gotten bigger and bigger and bigger. Everybody's in network now. So if you go to a PPO and you say, man, these discounts, they suck, and I'm getting 10% off, but they're raising rates 700%, and they're charging me for stuff that they're not using, and there's all this fraud. They told me to get the Argus coming to kick the claims. I need these rights in my contract. I need you to negotiate with these providers and get me the right to do an audit. You know? Give me the right to have all the details before I have to pay. To hell with your 30-day period, right? And I don't want to pay for duplicate claims. And, you know, I don't want to pay more than, 200% Medicare. Your PPO is saying to you, well, I don't have anything to negotiate with. Right? What incentive does the provider have to give in to your demand? Right? And if you read these periodicals and journals coming out of provider-based, the AMA and these groups and advocates for hospitals, they're saying, hospitals, get out of your networks now. It's not worth dealing with it. And so you're starting to see now hospitals all over the country saying, we don't accept any networks, you know. We're going to bill the patient, and they're going to have to deal with you directly. So that's what you've got to look out for. I'm not saying you have to drop your networks. I'm not. I know that's a sexy new trend that's going on. It's like, oh, we pay Medicare plus an XYZ%, and that's it, and deal with it. I'm not saying you have to do something like that, but what I am saying is you have to start looking at alternatives. And I happen to know for a fact that Cypress is one of the organizations that is open to considering alternatives. That's why they have all of us here talking about stuff like this instead of the same old, and auto adjudication, and let's all go gamble. So the example I can give you is the metro system, the public transit system in Boston. It's called the T, and they're currently in serious financial dire straits. And among other things, they self-fund their health benefit plan. And what they did was Martha Coakley, who's the Attorney General, she's also the plan administrator, or she's assisting the plan administrator, I can't remember the organization, but they went and they looked at the plan, and one of the big issues was every provider in Massachusetts was in network. So they did a study, and they found that Mass General, as a hospital, was charging a lot more than all the other hospitals in Boston. So they went to Mass General, and they said, listen, if you don't bring your rates down, we're going to drop you from our network. Mass General said, you can go pound sand. So they dropped them from the network. So now they're out of network for every pretty much Metro employee in the city of Boston, which has actually turned out to be quite a big deal. In addition, the unfortunate backlash was that a lot of the people who had been going to Mass General went to Beth Israel or went to Brigham Women's or one of these other fantastic hospitals. These hospitals didn't have enough employees, doctors, nurses, to check all these people in. And so now there's a huge wait, which I guess if you're one of these other hospitals is a good problem to have, because the business is booming, but they now have to deal with this new growth in business. So steerage works. Steerage works. The thing is, one of our buddies, he works for the T, he called Adam freaking out and said, they're cutting all my benefits. They're cutting all my benefits. Adam says, what do you mean they're cutting all your benefits? They're knocking providers out of the network. I'm going to have to pay it all myself. And so the question was, well, which doctors do you use? Which hospital do you use? Which hospital doctors do your family use? And they were all still in network. So the attitude is, well, what if I'm in Western Mass and on vacation and my kid breaks, her leg? Well, emergency care is still covered. It's a completely different, this is pre-cert plan covered emergency. It's a whole other set of rules. So what's going on? Yeah, and they reduced his contributions by, I think it was 20%, all right? Deductibles were cut in half, co-pays were cut in half, and the plan is saving money as a result after year one. The problem was, whoever it was at the T, and they're government employees, so if I have any good employees, sorry, didn't mean to say anything. Boston government employees. Do I have any Boston government employees? Of course I don't. They'd be outside drinking by now. So because we're running out of time. So boss, whoever it was that went to the employees, and this is highly relevant for you, did a terrible job of explaining what they were doing and why. All they said was, if your provider is one of the following, they are no longer in network. Thank you, return to your whatever, you know? So very little, I mean, I just explained it to you, right? And you get it. So that's sort of one of the big problems was the lack of education. We're coming up on the end. Healthcare reform. I assume you've all heard about it. So healthcare reform, a couple of the biggies that we've been dealing with recently are SBCs, or Summary of Benefit Coverage, and the independent review organizations. SBCs, the bottom line is that there is no bottom line. We were at SPVA, which is a major industry conference. This was great. They had a rep from the DOL, HHS, IRS, and I can't remember who else. That was the driest bunch of people I have ever heard in my entire life. I swear to God. It was awful. But the one thing I did get from the IRS guy was when you're putting together this SBC, which is just sort of a summary of the plan, it's meant for comparison purposes. It doesn't have to be accurate. It could be reflective in general of the type of benefits you offer. Because a lot of plans offer multiple different plans, and they're like, well, do I need to come up with an SBC for each plan? What happens if my plan changes its rates? What happens if there's split rates? How am I going to fit this into 8 pages? Really funny story about the 8 pages, by the way. When the regulation first came out, it said 4 pages. And it also said that the DOL and HHS would put out a sample SBC. And when the sample came out, it was 6 pages. So whenever I said, you're the IRS, so I assume you can count, 6 pages, 4 pages, they said, no, 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 we meant 4 double-sided pages or 8 single pages. Yeah, the rules are flexible. So there you go. So now we're up at 8 pages. This summary, do I have to put out 1 for each individual plan? And again, the repeated response was, no, it's just for general comparison, just for general comparison. Now, I assume it's meant to educate people about how the plan processes claims, not how much benefits are actually available. Because my comparison was, well, if there's a law that's passed that says all auto manufacturers need to put out a sheet that has their most popular model and 4 of the most comparable models, price, warranty, resale value, horsepower, all the benefits, all the pros and cons of the car, so that you could look at the sheet and you can compare. And at the bottom, in fine print, it says, this may not be accurate. Refer to the brochure for accurate details. There's only 1 or 2 possibilities, right? Either 1, the person sees that and they go, aha, and they go and they look at the brochure, in which case, why did they look at the sheet in the first place? It's 1. Or 2, they don't see the fine print. They base their decision on the sheet, only to be unpleasantly surprised later. And when they come back and they want to sue you, you could say, ask the IRS. They said it doesn't matter. In which case, again, what was the point of the sheet? So in both examples, it serves no true purpose. And I'll leave it there. IROs. Basically what this means is you still have your administrative appeal process, but if a person still doesn't like your answer after strike 3, they can demand that this now be presented to an independent review organization. Really funny. When we first heard about this, we started calling all the IROs in the country to see how they were ramping up to take care of this. And the response from most of them was, they have to do what? And you could see just sort of the waves of emotion, It goes from, oh my God, this is the best thing ever, the law requires people to use me, to, oh my God, where am I going to get all the people to do this? So I'm sorry, hopefully things have changed in the last year or 2, but they had no idea that this was coming. My big issue with IROs is, if you're a plan, there are certain deadlines you need to meet when it comes to an appeal. Not only because of the law, but because of your network discount, because of your stop loss. When someone's appealing a claim, there's a clock that's ticking, and you have to get it all done within a certain period of time. My question is the IRO bound by the same deadline? And if something goes to them, and they make their decision, and it comes back, and it ends up a claim you thought was denied is now payable, but your stop loss contract is already expired, I mean, are you up the creek without a paddle, right? That's a good question, I think. And the second question I have is, one of the benefits of being a self-funded private ERISA plan is your administrative decisions, if it's appealed to a court of law, they're treated very deferentially. What that means, deference, is that if there are 5 experts, 4 of them disagree with your decision, and 1 agrees, your decision stays. It's upheld by the court. Because the court doesn't make its own decision. The court just has to decide, did you have some reasonable basis for your plan determination, your claim determination? That 1 expert is enough to make it reasonable. It's not arbitrary. It's not capricious. That's the standard, arbitrary and capricious. As long as you have some reasonable basis for making your decision, it's not arbitrary, it's not capricious. It's in the law if you're a private self-funded ERISA plan, that courts show you deference. But do courts show IROs deference? Because here's the issue. Let's say you deny the claim once, twice, thrice. They appeal it to an IRO. The IRO agrees with you. And now the participant appeals the IRO's decision to the court. Is an IRO shown the same deference as a plan? Or can the court now look de novo, which means with new eyes, and now the 4 experts versus the 1 kills you? I don't know the answers. I just ask the questions. If I knew the answers, believe me, I wouldn't be taking the red eye back tonight. You know what I'm saying? Last but not least, this is true. This is happening now, and it's starting. Does anyone want to guess which state of the union this is going on? You're my guy. In California, right now, they passed a law that basically says that a stop-loss carrier seeking to provide coverage to a plan of a certain size is not allowed to offer spec less than, I think it's 50,000. And basically, the attitude is that small employer plans, they can't financially support a self-funded benefit plan. But because the cost of insurance is going up, up, up with reform, these small plans that never considered self-funding before, now they're looking at self-funding. But the problem is they can't afford the risk. But some sneaky stop-loss carriers are coming in, and they're offering them stop-loss with spec of $10,000, $5,000. And now they can self-fund without actually self-funding. And so they're doing an end run around behind healthcare reform as if they were self-funded, but they're not really self-funded. Now that's the attitude. The truth is, I know it's because they're worried that all the employers who were expected to drop their insurance entirely, and I'm sure you heard all the news articles when the law first came out, you heard all these employers saying, it'll be cheaper for me to just pay the penalty to the IRS, send all my employees to the exchange, and give them all pay raises, right? Are now saying, whoa, 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 there's a third option, self-funding. Hey, I like this one better than either full insurance or the exchange. Now all of a sudden they're thinking, oh, what are we going to do? All these people we were anticipating were going to be in the risk pool in the exchanges. They're all self-funded instead. Well, how do we do it? I know. Let's make it really difficult to self-fund. Well, how do we do that? We pass a law. All right. ERISA man. You can't pass that law. All right. Well, what are we going to do then? Let's regulate stop-loss. And that's the back door to regulate self-funding, is regulating stop-loss. And so that's what's happening there, and it's being considered by multiple other states. So if you care at all about your self-funded plan, put your ear to the ground, take a listen, and maybe do something about it. And last but not least, this is what we're talking about there. Will the PPACA survive the Supreme Court? Don't ask me, I have no idea. I will tell you that it's going to be a very close call, whichever way it goes. For those of you who are not completely aware of the problem, basically healthcare reform, in order to pay for it, is mandating that everybody get coverage. Because the attitude is, if these people, otherwise healthy people who don't usually buy insurance because they're healthy, are just pumping dollars into the plans, into the exchanges, that money can then go to pay all the mandates, which are expensive. And so by forcing everyone to buy insurance, it financially funds all the other parts of healthcare reform. And now the attitude is, well, forcing people to buy insurance is unconstitutional. You can't force people to buy anything. So that's the section that's being argued over. The more important issue is the severability issue. Now, if I've ever written a contract for you, it's a work of art. And in it, there's a severability clause. And what the severability clause says, if any part of this contract is deemed to be illegal, the rest of the contract still applies as if it's been severed from that illegal section. And of course, you have the right to go back to the agreement and amend it if you feel like that severed section was really important to the whole. But the point is, in the meantime, it's a Band-Aid. This law doesn't have that. So there's three possibilities. Either A, the court says the mandate's unconstitutional, strikes down the whole thing because there's no severability, back to square one. Two, they strike down the mandate as unconstitutional, but they assume a severability clause. I have huge issues with that. Because if you're a congressman and you're sitting there and you're listening and you read the law, right, you read the whole thing, and you say, I'm voting yes for this package of goods, this whole plan. If you were to ask all those people that day that they voted, well, what if in the future, for some reason, the mandate was removed? Would you still vote for it? I guarantee a lot of them would say no, because they'd say, where the heck's the money coming from, right? You know where the money's going to come from. But anyway, so I have a huge issue with that kind of legislating from the bench. The third possibility is that they say it is legally allowed, it's not unconstitutional, full steam ahead. And I almost in some ways, metaphorically, philosophically, I prefer that outcome than assuming a severability clause, because where's the limit then, you know? I mean, they could read any law and be like, oh, I'm sure they meant to include something about Supreme Court justices having their pension doubled. You know, it's like this is a law about animal rights. Like, I don't know. So hopefully, come June, we'll see, and we'll be sure to let you know. So here's the contact information. If you do Google me, make sure you include the middle initial, because I discovered, much to my chagrin, that Ron Peck is a world-famous producer-director of erotica, mostly focused on young men. So again, I'm evidently very well respected, but not me. So make sure you use the middle initial and quotes just to be safe. Feel free to log in. You know, we do webinars all the time. It's free of charge. They're usually fun. You know, again, if you need business cards, I've got 2 pockets full because I got to run through my business card budget, or they'll cut it next year. It's the Massachusetts way, man. Got to burn through the budget quick. It's my own big dig. And that's it. So thank you.